So we are now live, and I'd like to let Reverend Lynn Miller-Jackson start off.
Good morning. I am Reverend Lynn Miller-Jackson. I'm the pastor at Hilltop United Methodist Church in Sandy, Utah. And I'm glad to be here this morning to talk about child homelessness as this report is being released by the Crossroads Urban Center. I've seen the campsites in Salt Lake City and actually elsewhere in the country. And I am always struck and concerned that it just doesn't make any sense that in a country with so much abundance that we should have homelessness as an issue at all. We spend billions of dollars doing space exploration, yet we can't seem to solve the affordable housing issue that are here in this country. But I'm particularly concerned about child homelessness. As a United Methodist, as a person of faith, I do believe that all people are of sacred worth, and our children are of sacred worth. And those experiencing homelessness are amongst our most vulnerable. I'm concerned about the lasting effects of the trauma of homelessness in children, that especially when we consider the layered impacts of the conditions of this day, whether it was the earthquake we experienced in March or the pandemic that we are currently moving through. And there are so many other layered impacts that the kids are being, that are impacting the kids today. And I'm convinced that we can do better. We can do better, and that we absolutely must do better to meet the needs of the least, the vulnerable, the innocents who are among us. And we need more people to partner in efforts to address the causes of homelessness, to dismantle any of the systematic structures that perpetuate the conditions that contribute to these conditions. We need for those who are within various spheres of influence to join hands, to walk shoulder to shoulder, not just to put a Band-Aid on a temporary situation, but actually to provide the support to help those who are weaker than others to gain the strength so that they can walk forward in dignity and make progress forward in their lives so that the entire structure of this social structure that we live in may be improved. With that, Bill, I'll turn it over to you to actually talk about child homelessness.
Thank you. It's one of the things I really like about working at Crossroads Urban Center is that we are an interfaith mission institution of the United Methodist Church, and as such, I get to meet people who every day who are committed to helping those in need, and they don't just care about people in poverty, care about homeless people, but they show up with food, with clothing. They show up, and they also show up to talk to elected officials about ways that we as a society can reduce the number of people who need those kinds of help. We are producing this report right now for a couple of reasons. One of those reasons is that this has been a really tough year for homeless children in Salt Lake County. We have a pandemic that led to our homeless shelter being temporarily quarantined, the one for families with children. And we have a whole bunch of people who have been frightened to go to a shelter. And so we've seen a surge in domestic violence because people are staying in bad situations for longer than they would in previous years. And so I think, there are a lot of reasons to be concerned about homeless children, homeless families in Salt Lake County right now. I think the biggest one from a long-term perspective is that we now have had 2 school years disrupted. And so you have children who are already behind, and the research is very clear that being homeless as a child leads to kids falling behind, and that kids who are homeless are much more likely to be held back for one grade, much more likely to be held back for 2 grades, and that being held back for 1 and 2 grades makes you more likely to drop out of school altogether. And so I think when you have kids who are already behind, having last year school year end early, and this year having schools, a lot of them learning be remote learning. I mean, if you are a child at the Midvale Family Shelter where there are 200 kids going to 70 different schools, that building was set up to do a lot of wonderful things, but it was not set up to facilitate online learning. That's not and I'm sure, I mean, people are doing the best we can, but it's just realistically, I mean, the kids, we have kids who are already behind, and odds are that they're going to get more behind. And so I think it's really important to look at child homelessness. And so what we did at Crossroads Urban Center is we spent some time looking into the data that's available to the public about child homelessness. And we found some things that we think are helpful in terms of not just seeing the scope of the problem, but coming up with ideas for reducing child homelessness and improving outcomes for kids who are homeless. And so I think the first thing that we found that's worth mentioning is that there were 9,082 people and families with children who received homeless services in Salt Lake County during the years 2017 through 2019. So in the last 3 years, there were over 9,000 people and families with kids who were homeless. And I think that 2,780 of those people were age 6 or younger. And so we are having, this is not a small problem. I mean, there are thousands of kids under 6 who have been homeless in Salt Lake County during the last 3 years. And so when you look at that group as a whole, a lot of people are leaving the shelter quickly. A lot of people are only homeless once, but there are significant subgroups who have been homeless multiple times, and when they do go to the shelter, they end up staying for 6 months and longer. There were 486 people and families from children in Salt Lake County who stayed in a shelter for 6 months or longer during the last 3 years. When you look, just last year, there were 215 people and families with children who in 2019, their family became homeless for the 4th or higher time in the last 3 years. And so we have families with kids, with really young kids, who are returning to the shelter 4 or 5 more times in a 3-year period. And I think when you look at the research on child homelessness, there are really significant outcomes in terms of physical health, in terms of mental health, in terms of educational attainment. And that research suggests that all of those negative outcomes are intensified with the repetition of homelessness and with the duration of the period of homelessness being increased. And that makes sense. I mean, it's pretty clear that being homeless is a traumatic event for children that takes time to recover from, right? I mean, it always takes time to recover from trauma. You can't recover from the trauma of being homeless, of being dislocated like that, of being uncertain who's going to be sleeping in the room with you every night. You can't recover from that trauma if it isn't over, right? I mean, if you're and so a child who's in the shelter for 6 months, 9 months, is going to take longer to recover, right? I mean, and that makes sense. I think we also found that domestic violence is a significant factor in how families with children become homeless. During our 2020 point in time count, there were 157 children who were living in a shelter for survivors of domestic violence. Crossroads, we did a survey back in 2017 of homeless mothers, and we found that 66% of those moms had a history of domestic violence. And as I said earlier, I mean, according to news accounts, since the beginning of the pandemic, Salt Lake County prosecutors have seen a 21% increase in domestic violence cases, and 911 dispatchers have handled 30% increase in calls about domestic violence. So this is, I think, people, when they come, with kids come to a shelter, they have the traumatic experience of being homeless, but they often come in already traumatized by something else. And that's, again, what the research shows, is that being homeless is traumatic, but it also increases the likelihood of being exposed to other types of trauma. And I mean, and that makes sense, right? I mean, if you are living in a shelter and there are 3 other families in the room you're in, or more, the odds that you'll be a witness to an incident of domestic violence in somebody else's family goes up. I mean, that's, another thing we found is that schools use a more comprehensive definition of homelessness for children. And so they identify about 4 times more homeless children in the school districts than those who receive homeless services. And so it's just good to realize that, you know, when we talk about child homelessness, there are the people who show up in the shelter, and then there are the people who are doubled and tripled up and unsure where they're going to sleep week to week. So that's what we know about child homelessness. The full report is on our the Crossroads Urban Center website, crossroadsurbancenter.org/report. So we encourage you to look at it and talk to your representatives on the county council and in the state legislature about it. But we didn't produce a report just to complain about a problem. We also wanted to look for potential ways to reduce child homelessness and improve outcomes for kids who have been homeless. And so our first recommendation is to produce 150 units of supportive housing for families with extended or repeated experiences of homelessness. I think I mentioned just a minute ago about how there is a significant subpopulation of homeless families with kids who are homeless for 6 months or longer, or are homeless for 4 and more times in a 3-year period. I think those families need supports that other homeless families don't. We have a model we have some experience with providing permanent supportive housing. That's a national model, and we've had some real success with that. I've seen lives saved. People I thought for sure were going to die on the street who moved into permanent supportive housing, and they're still alive. And so I believe in that. What I also, at the same time, it's very clear that this housing, it was designed to help stabilize the lives of people who've been on the street for a long time, extensive history of mental illness, sometimes history of addiction issues. And it's been that the needs of that population are not necessarily the same as the needs of a single mom who's 19, who was homeless for most of her pregnancy, right? I mean, that's that mom has different needs than somebody and I would say that it's really important to realize that her child, her infant, has different needs altogether than any homeless adult. And I mean, this is important because national research shows that the time of life when a human being in this country is most likely to be homeless is during that first year. Infancy is the time when people are most likely to be homeless. And so I think what we need is housing that's really specifically designed to be child-centered and designed to help parents who are currently just not going to be able to keep their family consistently out of the shelter to develop in ways that, hopefully in the future they'll be able to do that. And I mean, so that, going back, you have a homeless mom. She was pregnant a bit as a kid. Was pregnant for a lot of her pregnancy. She homeless for a lot of her pregnancy. She's not going to be able to consistently keep her kid off of the street right now. I mean, she's been in the shelter for 6 months. She's not going to be able to do that on her own. But if she gets the support she needs during the first 6 years of her child's life, if her child has childcare on site at the shelter, if they have healthcare services on site, if they move into a school that has a good relationship with the place where they live, so that they have a plan in place to help that kid thrive, then she can confidently get a GED. She can confidently get a certificate from the community college. She can get a first job. There are all of these landmarks that are so important in terms of being independent, and people are not going to get those in a shelter. You can't, if you don't have a home, you're not going to be able to make progress on other things. So that's our first recommendation. Our second recommendation is that we create the Salt Lake County creates a housing affordability commission that has a specific charge of identifying housing needed to reduce child homelessness and opportunities to produce that housing. In 2018, the state legislature created a housing affordability commission for the state. And that commission has come up with some policy ideas and funding ideas for addressing housing affordability in the state. I think at the county level, we need a commission made up of people directly involved in the housing work of housing the homeless. We're producing housing generally. We need housing authorities, we need nonprofit developers, for-profit developers. We need people who actually can produce this housing, and to coordinate, like what are the needs, who can step in and meet some of those needs. I think we've heard from a few different sources that one thing that this commission could do when it starts is take a look at properties owned by Salt Lake County and other governmental entities in the county that are currently unused that could be used to spur the development of affordable housing. We're in a recession. County and local government budgets are hurting. They don't have the resources to put cash into promoting affordable housing, but they have a lot of surplus property that could be purposed in this way to produce some of the really targeted housing that's needed to address child homelessness. I think, I was talking earlier about the most targeted form of housing, which would be the supportive housing for families. The truth is, I mean, there are all kinds of programs we have for helping families get out of homelessness. There's a rapid rehousing program where we help people with rent on a short-term basis. The success rate for that program is going to be higher if people are moving into apartments that cost $800 a month than it will be if they're moving into apartments that cost $1,200 a month. I mean, if you're at a job where you get paid $12 an hour, you need a place to live that you can afford. So that's creating a housing affordability commission to coordinate efforts to address housing affordability and move things forward on that would be a very positive step that way. Our third recommendation is to capitalize on full Medicaid expansion by enrolling every kid and parent who shows up at a shelter in Medicaid or some other healthcare plan, but then going another step and actually connecting people with their healthcare provider. It doesn't do any good to enroll people in Medicaid if you know they have needs, and kids and parents who show up at a shelter are gonna have needs, and you don't connect them with those services. So we think it's time to set the goal of enrolling parents and actually connecting them with their managed care network and getting referrals to the services they and their parents and their children need. We also think there are options available at the federal level for helping families to stay in their home and making that a bigger part of states' Medicaid plans. We would like to challenge state leaders to look at how some of those services, which could be used to help prevent child homelessness. And then, I mean, our last recommendation is just going back to where we started, which is with the pandemic. We need to continue the rental assistance programs that have been continued to help prevent people from becoming homeless because of the pandemic. We also need to bring all hands on deck to help kids who are falling behind in school to catch up, or at a minimum to figure out who is falling behind so that we can catch up in future years. I think, and so those are our recommendations and what we found. I would like to let my friend, the Reverend Elizabeth Hunter, talk about a little bit more about why people of faith, why people in the coalition of religious communities care about child homelessness and think we have an imperative to do more to reduce it.
Thank you, Bill. I'm Libby Hunter. I'm the retired deacon at St. Mark's Cathedral in Salt Lake. And we're a member of the Anglican Communion. And I think that's an important word because communion means community. And the Episcopal Church, people may not really believe this or know this, but we do have a catechism that we're to Christ. And we're defined on how we live our lives. And we follow a book of across the Anglican Communion. And again, it's telling us, showing us how to guide in prayer and celebration and living. But the key word is communion and community. We're not personed alone. We're personed with other people. We're personed within a community. I'm not part of just St. Mark's. I'm part of Salt Lake City. I'm part of Utah. And in this wider community, we as people of faith have a responsibility for all of the people in this community. And as Reverend Lynn so eloquently talked about the impacts, and as Bill's statistics have pointed out, children can't feel safe, they can't feel secure, they can't grow physically, psychologically, mentally if they aren't safe. And one way to ensure that they have some safety is that they're in a safe, secure home. And that could be an apartment, but it's difficult to imagine children growing and thriving if they're living on the street or in a vehicle or in a temporary situation where they don't know where they'll be the next night. Our Most Reverend Michael Curry, who's the presiding bishop of the Episcopal Church, he asks us to be committed to living the way of God's unconditional, unselfish, sacrificial, and redemptive love. And our faith tells us that we have to be witnesses to the worth and dignity of people. Any Christian denomination could quote all kinds of things from the Bible to talk about why we need to care about our neighbors, why we need to care about children, why we need to care about the poor. But one verse from John says, "Let us not love in word or talk, but in deed and truth." And I think one of the things that we as members of faith communities can do in deed and truth is to read this report. Make sure that we encourage other people to read the report. Know what the statistics are, know how this impacts not just a single family, not just a few people, but our whole community. We couldn't have known years ago about the pandemic, but it's impacted us greatly. It's impacted the resource centers. We couldn't have known, but years ago when the resource centers were being developed, we knew then that there would not be enough space in the centers for all of the people who were being housed at the road home. We knew that then. So our imperative is to go to our elected officials. It's to go to our legislators. They're the ones who make the decisions about the money, about the funding, about the programs, about the services. We need to be familiar with the report and go to them with the statistics and with the information and plead with them as people as part of this community, and not just as people of faith, but just people who care about other people, that we need to solve this problem. The problem of childhood homelessness is going to impact our state and our community for decades to come if it isn't resolved.
Thank you, Libby. I want to say that we've shared this report for both candidates for county mayor. we are planning to reach out to every state legislator who represents Salt Lake County and get them a copy of the report. But we can absolutely use help from people talking to their individual legislators because, they don't necessarily care about somebody like me who doesn't live in their district. I mean, I'm not saying they don't care. It's just like they're much more interested in hearing from people who live in the neighborhoods they represent. And so we can use your help in presenting this report to state legislators, to members of the county council. When the elections are over, we're gonna, talk to people who won elections. So we have a group that works on this issue at Crossroads Urban Center called the Coalition of Religious Communities. You can sign up to get email alerts from them on our on the Crossroads Urban Center website, and you can get a copy of the report on our website at crossroadsurbancenter.org/report.
There are competing needs that our elected officials and our legislators will have to deal with. I understand that, but it's important that they know the details and statistics and how the preventive measures we can take now will impact this community and this state for years and years to come. It's people's lives.
It is people's lives. And I think that Reverend Elizabeth, that as you said, it's not just that we have the statistics. It's not just that we talk about it. It is what we do with the information that we have. Yeah. When we know better, we can do better. So since we know better, let's do better. I just want to say, the elected officials are part of the solution, but each individual who gains access to this information is also part of the solution. We all have our own circles, our own spheres of influence. And as long as you have a voice of some sort, use it, exercise it to take action, because that's the only way that we're going to move forward and to be able to make the change, the systemic changes that we need to remedy this problem. So, Bill, thank you for all that you do and for arranging this. And I'm grateful to be a part of this coalition of religious communities and helping to move us forward.
Thank you so much for helping and for your insight. You're absolutely right. I mean, we all are agents. We all have our sphere of influence, and this is something where if we all chip in, we can collectively make a much bigger impact than any of us could on our own. Thank you. I think we are now done. But thank you.